So here you go with, let's start it with Code for Tomorrow. And you may be wondering that why we call ourselves Code for Tomorrow in the first place, because we started quite early in 2012 in May. And okay, here's, it's being supported by, of course, Open Knowledge Taiwan and a couple of other local partners in Taiwan as well. I think the funniest part, that's why we call ourselves Code for Tomorrow, is well, we got the idea from this sort of map, Facebook, the social graph of Facebook. So if you take the data from particular place, for example, Taiwan or Hong Kong, you are getting to see the friends connection in other nations or places or cities across borders. So we were thinking that the problem that we were facing might also be the problem somewhere else in those regions, cities. So we take a screenshot of this page, and we are seeing that the people from Taiwan are very close with their friends in Japan, South Korea, Hong Kong, Malaysia, I'm not sure, and Singapore as well. So we got our data, we call ourselves Code for Tomorrow, and of course there are some other brigades in Taiwan which call themselves Code for some other cities as well. So we got the idea from this because we, in that part of the world, we really want to focus on the guanxi. I'm not sure if you know the term. It's like the relationship and connection in a dynamic society in the Chinese culture. So if you are pushing for the theories of change, the guanxi or relationship between you and those people, the government and the citizens, and stakeholders. That's why we are very much focused on how to get people involved and be seen by government, or how government workers are to be seen by citizens. Because it's hard, it's hard if you don't create a platform for people to engage with each other or even talk to each other. It's hard to make things happen, and there are a lot of people living in that circle. So the challenges you are going to face will be very huge, okay, within that circle, okay. So people are far more connected than you think, and people there they generally favor ground connection more than online connection. So ground connection is very important for doing a lot of things with the government or within the civic tech ecosystem. And there are a whole new stack of digital natives. I'm saying this because we get our largest source of coders or enthusiasts from the very young generations of people. So for me, I'm in my 30s, but we get a bunch of those in 20s or in their 15s, participate in our events. It maybe hundreds of them participate in one event alone. So how are they going to see their government? How are they going to engage with the government? It's going to be a huge problem, of course. And it's the last, it's insanely divided between the civic and GovTech. It's like, there's a great gap between that. So they don't talk to each other. They are not seen by each other. So so we started worrying about tomorrow and started to do something from now. But we took the metaphor a little bit different. We think ourselves as sort of doctors or nurses or physicians. So we take the metaphor as we are pumping some or administer some drugs into government, or we take some vaccinations or sorts like that. And this metaphor worked quite well in the past because we have a lot of activities on the left. You can see the hashtag. We have meetups, workshops, hackathons, Open Data Day, of course, and a lot of you are probably very familiar, and we are highlighting 3 of them. So that's probably like the procedure that we are trying to tackle some of the problem and make impact within the government or outside government or among stakeholders. So of course you will see symptoms, and you got check, and then you tell your patient to exercise or you administer some drugs for them. And sometimes you have to go to some real surgery, so you have to put them into the lab or go to their place to do some things, dirty things. And sometimes they need to, after they come out of the hospital or the ER, they have to do some rehab. Okay, so that's how we how we are seeing this sort of thing. So we took I don't have a medical background or a physician background, but we have been partnered with one of our major projects called Code for Healthcare. We partner with 37 hospitals, and it is a huge challenge So I'm highlighting one of the projects that we've been doing right now. Even you can't find our website right now. Okay, we are still doing that. So it's Code for Healthcare. This is actually a sentence, a word by one of the founding doctors. He said that it's like, in the medical system, it's like why you have so many clinical guidelines to follow. Why don't you have dream to improve your healthcare system by starting looking at the data that they have? So we code this like the converting compliance to compassion. It's like the CCC, Computer Chaos Club in Germany. Okay, you know that. Okay, you know the CCC. Okay, so the hospital, one of the hospitals, of course, they have been doing this data-driven, medical policy for long enough. So they have pile of data. It's being digitalized, and they are connecting other 36 hospitals with that. So they have a sort of like an overarching, architecture over their data exchange program already for like 3 years. So this sort of like exchange program is it was funded by one of the doctors in the ER system, but we encountered some huge problems like that, just like the case happened in Japan. Whenever you came to a disaster or crisis that is nationwide or in a severe scale, you are going to be faced with a lot of challenges, and you need to bring civic technology into it. So this is actually a screenshot of the explosion in the second largest city in Taiwan, which is called Kaohsiung. So it's like the gas pipeline or the oil pipeline exploded. So the railroad exploded, and the length of the explosion was like 2 kilometers. 2 kilometers. So there were more than like maybe 14 ambulances being buried down on that explosion alone. So you are seeing that the doctors started to get the data out after they have the time of massive explosion, and did some data analysis after the explosion. But they are facing some major obstacles as to how this sort of experience could be channeled into some more insightful policy change for the hospital system. Okay, so these are some of the questions that came to mind from those doctors on the field. So for example, the first one is what the surge impact, and what about the ambulance diversion? Because all the ambulance, I'm not saying all the ambulance, about 16 ambulances were destroyed on site at the first time. And I think more than 20,000 people on that those blocks were affected, 20,000. So, and then what about conjoined heterogeneous data for more insight relevant to disaster preparedness? So these like symptoms, the real symptoms, and they have the data. For God's sake, they have the data already. If you don't have that data, you are not going to reproduce that again. You don't want that happen again. So we ran this like the fourth hackathon in a series. So we did some checker, we call it checker exercise and surgery. So you can see the stakeholder on that hackathon. You have a data scientist. Let me see the pointer. Oops, no pointer. You have data scientists. You have nurses. You have some professors with very white hairs, ladies, and firefighters over here. These are all firefighters. So they were doing hackathon and design their own apps because they need a tool to report the ground situation back to the like emergency operations center right on time. But they don't get the evidence in their procurement process. So we help them to. So this is like some of the very easy outcome out of that. So if you are very tech savvy, this is nothing, but this really help them to move their their situation forward for better tomorrow. So this is one of the projects we've done, and we've been doing for a year right now, and we're supporting and funding from hospitals and some of the government Ministry of Healthcare. And another program is like it's a data science program. So we focus on the demand side first. We don't focus on open data because there are other very strong communities out there doing this already. So we focus on identifying real needs. Open data for what? And the second point is that we focus on talent pool, not data pool. So we try to identify the right people and provide them to government, to stakeholders. Okay, and data for social good. So we run a series of events. You can see even young kids or children are very interested in civic tech. So it's like a coding school. And then Checker, you have events, you have doing prototype right away by some very high-profile app developers in Taiwan. And then you have an exercise, you put it on Open Data Day, so you get like 300 people working on a few projects which could move the agenda forward. And then the official drugs and gene. What I'm saying is drug because it's a paid course. So you have to, we were thinking about funding from the very first start. So it's like a data science training program for government officials, for doctors, for journalists. And this program is sort of like our cash cow. I will not say cash cow, but like provide us a momentum to move forward. So you can exercise here. A lot of data scientists you have here. And then there's a rehab conference. This is actually a rehabilitation conference. Yeah. So we call it a Smart Gov conference. So you see the guy with the very white hair there. He used to be the Minister of Interior. So he's quite high profile. And we brought all the stakeholders and their project on that conference. So people get together, see the progress, and move things forward. So it's like a treatment, along the way. And we try to get people together. Okay, so time's up? No, almost. And more surgery workshops. And this is like, we took an idea from Health America, so we have emergent program training, incubation. But I think this is the most important part. We did a lot of things wrong, but yesterday is never back. So by now, if you check you try to check the website, you are not going to see any sign. You're going to see our activities on Flickr, a lot of photos on Flickr, but you are not going to see an official page of our, brigade, because we run into one of the biggest problems is that about trust. What about does transparency really beget trust? Because we were working, or even now, we are working very closely with the government, and they are not really used to that. If you are to your attitude as you are doing and saying the things that you are doing with them. So in order to move things forward, you have to, hide something behind for the sake of, 关系 or, sort of idea. So it's very hard to get trust from the government because some of us are already, well, not in the government, but we are being invited by the government as, joining a lot of committees. So like Open Data Committee for different ministries or for different cities. And the second one is why don't we just leave it alone? Because there are some agencies, you just can't change it. It's not going to change. It's like if you are, you're like in your 90. What are you going to do something with your arthritis? Probably no. Okay, so that's the idea that we've got. And then it's very hard to do it as NGO. That's why we failed to fund ourselves as an organization. We were very successful at the project level, but we have never been able to fund ourselves as an organization, on the organization level as a mothership for the other project. So some of our projects just took off, got investment, and became social enterprise. But it's hard to get back. So if you are doing it as a business or as a social prize, it's going to work. And consolidation versus diffusion. Are we going to consolidate ourselves as an organization, or are we going to diffuse our people to some other stakeholders? So that's why we choose the second one. We are phasing out of the stage right now, but we are trying to provide our experience and connection with the government to other stakeholders in Taiwan. So that would be our stories, and please remember that because there are more people living outside, living inside the circle. So from Pakistan to Vladivostok, no one from Russia, and Bali, Indonesia. So there are really some tough challenges out there. I think the Code for All platform will be very invaluable for a lot of us. Thanks.